I always had like a little issue with drinking when I was younger, and then the pandemic happened and I guess kind of like fell deeper into that habit. I feel like I was like never a bad guy, I just had a bad habit.
Criminalization of mental health started in the 70s, and all of a sudden the jails were getting full of people with mental health issues. You had post-traumatic stress with the veterans and substance use disorders, and they were all just getting carted into incarceration, which not only was not a place for them to recover from, but it was a place that was very expensive. So finding alternative roles and alternative programs is what we were doing.
Unlike any other place I've ever served, there's a commitment from the entire government and community to handle mental health, behavioral crisis, and substance abuse in a different way.
The community buying in and looking at this as a mental health issue, not a crime issue, and being able to separate the two has really been the evolution that I've seen just out in the community. So even victims see the difference between someone who is in a mental health crisis versus someone who's committed a crime because they're a criminal.
The beauty of stepping up is that a lot of the preliminary work has been done. It's up to the individual jurisdictions to tailor their program to meet some of the same objectives. And this is something we've been thinking about and putting in action for a long time. Its companion Diversion First program came about just about 10 years ago when we as a county said, hey, we've got to look at these issues differently and try to figure out a way to provide services and resources that would help divert people to assistance and also at the same time provide relief in our budget to escalating jail costs and costs of incarceration.
We started a crisis receiving center where officers can come, they can drop individuals off rather than taking to the adult detention center. And then we have clinicians that are there that can do the mental health assessments. And we've really looked at the sequential intercept model on sort of building up our Diversion First effort here in Fairfax and try to say, okay, we have the crisis receiving center now, what's the next thing that we need to strengthen in our continuous services and care in order to be able to have a more robust community and model for our community here in Fairfax.
The last thing our police officers want to do is spend time interacting with someone who should be handled by another part of the government, by another part of society. So that's why the Community Services Board, that's why co-responders, that's why crisis intervention, and that's why our mobile crisis teams mean so much to public safety.
For years, if you called 911, we would provide you with $1 million fire truck with 4 firefighters and hoses and axes, or we would provide you with police officers with guns. But that's all we could provide you. But now we can provide you with services that you really need, and it eases the system. So when there is a true emergency, when there's a fire, when there's a medical emergency, those resources are available for that emergency. And mental health clinicians can take care of our community that are in crisis.
I'm a veteran myself, and I was seeing a lot of veterans coming into court and having these issues that they were getting because of their service. So we had to start thinking outside the box. And the great thing with stepping up in Diversion First is they're great partners for us in the courts, and they come and they help us with getting connections with other people in the community and other organizations.
Everything was all up to your actions and what you wanted to learn and take away from the program. It just helped me grow, learn about myself. I went from like being a server to a restaurant manager. I went from like being solo on my mom's couch with the ankle bracelet on my ankle to like owning a home and being married and having a kid, and it just changed my life completely.
If you're going to do this right, there are many different components in the full continuum that need to be addressed. And what we have done is strategically stack those over time since we first began this program. And you won't immediately find savings. This is something down the road that you can do an analysis on and look at various different metrics. But you will start immediately improving the lives of people in your jurisdiction, and that's a good starting place.
The system needs a lot of changes. There's a lot of things that could be done in a better way for the community and also for the folks who are going through the system. So I think the takeaway is you just keep working at it all. Bureaucracies are hard to change, but if you do it cross-agency, it's not just you versus everybody, it's like all the different agencies working together for their own good as well as that of the community.
I really do think that all of us aren't bad people. We're just lost. Sometimes some of us do have post-traumatic stress and and all that from the military, and stuff like this is something that is so great for us, you know, because it gives a second chance. We shouldn't just be thrown in the system, and this is an opportunity to not only save us but make us better and make us great for society.